So, COVID-19 is now being linked to developing diabetes. Up next on Unidentified Truth, we're going to go over what the hell the truth could be about this unidentified problem. This is a freaking problem. I mean, what the hell's going on now with COVID-19? I actually had diabetes. I'm a type 1 diabetic. This kind of hits home for me. It kind of makes me want to talk about. And if you're interested, let's talk about this. I have diabetes. I've been living it since I'm 31 now. I've been living with it since I was 14. So, of course, this is going to spark my interest in talking about it. And I definitely want to dive deep into this. This is Unidentified Truth. And I'm your host, Stephen Truth. Make sure to subscribe to the channel and leave a like on the video. And, leave a comment if you want to get in on this discussion today. So, to me, it's just telling us that this government is controlling us, and it's always been this way. I mean, it might be even obvious anymore now, more than ever, because of what 2020 brought us and how we look at our government and how it controls us. And the media tries to control us, and we're not stupid. I think I read a study before one day, a long time ago, but it said like 90% of people who have diabetes don't even know they have it. So this country has been feeding people, but not testing people for diabetes. I mean, how many people are out there that might have diabetes and don't even know they have diabetes? Probably a hell of a lot. So just this fact that COVID-19 is starting to expose people to diabetes, I think it's because people already have diabetes. And if COVID-19 is responsible for bringing it upon us, then there's something wrong with COVID-19. There's something that I don't understand. Like, you're telling me that a virus like coronavirus, and I guess I'm not a doctor by any means, they say that it's because, the virus brings down your immune system so much and messes with, this kind of virus can mess with your pancreatic insulin and your insulin cells or whatever the fuck.
Okay, so in a study by the CDC, children who have recovered from COVID-19 appear to be at an increased risk of developing type 1 or type 2 diabetes. This is according to research from the CDC. So a heightened risk of diabetes has already been seen amongst adults who have recovered from COVID-19. According to some studies, researchers in Europe have reported an increase in the number of children being diagnosed with type 1 diabetes since the pandemic started. So the New York Times has reported that this is what Europe is seeing.
So as you can see on Google, I just typed in study of how COVID-19 produces diabetes. How does COVID-19 cause diabetes? It says, in one study, researchers examined lab-grown beta cells infected with COVID-19 and found that they made less insulin when infected with the virus. So some of the cells died outright. And then I go on to the NIH director's blog, and it says, along with the pneumonia, blood clots, and other serious health concerns caused by the COVID-19 virus, some studies have also identified another troubling connection. Some people can develop diabetes after an acute COVID-19 infection. What's going on? Two new NIH-supported studies now available as pre-proofs in the journal Cell Metabolisms help to answer this important question, confirming that SARS-CoV-19 can target and impair the body's insulin-producing cells. Type 1 diabetes occurs when beta cells and the pancreas don't secrete enough insulin to allow the body to metabolize food optimally after a meal. As a result of this insulin insufficiency, blood glucose levels go up, and the hallmark of diabetes. But earlier lab studies had suggested that the COVID-19 anyway, can infect human beta cells. They also showed that this dangerous virus can replicate in these insulin-producing beta cells to make more copies of itself and spread to other cells. This is interesting. I mean, both studies confirmed infection of pancreatic beta cells in autopsy sample from people who died of COVID-19. Additional studies by the Jackson team suggest that the coronavirus may preferentially infect the insulin-producing beta cells. So, Jackson team also found that the infection leads directly to the death of some of those all-important beta cells. Encouragingly, they showed this could be avoided by blocking NRP1. Doctors are now saying that COVID is causing these things to happen. And I remember when I was diagnosed with diabetes, I asked the doctor, how the fuck did this happen to me? Because I was 14 years old. I was like, what the hell? I'm not fat, I'm not overweight or anything. And, he just said it could have came on by a virus. So, it's not unknown. It's not very different that a virus can hurt and bring on diabetes, but In this case, it's like, really? This is actually happening?
I mean, first they were saying, oh, you know, you can get serious illness if you have diabetes, but then now it's like, oh wait, COVID-19 actually causes diabetes, or actually is linked to make you have diabetes or expose the fact that you're going to have diabetes later in life, but now you're going to have it just because you caught COVID-19. It's going to misplace everything and make, you know, what you could be having in the future happen now. And it's a crazy world we're living in, and the way science is working, the way I really think bio warfare happens on a regular basis. I think it's a normal thing anymore. These pharmaceutical companies make so much money off of it because they do all these fucked up experiments to fuck up the world and fuck up its own fucking civilians, and they don't care. So with diabetes, I think it's something that they can play around with, because prescription drugs for diabetes are just getting astronomically higher, and it's getting ridiculous, really. And this is facts from the CDC saying in themselves, doing this research, admitting that this research that pretty much displays that diabetes is linked to COVID-19, and COVID-19 is attacking insulin-producing beta cells or whatever the fuck it's doing. It's wreaking havoc on our society, and even more so now. I think this is news that shouldn't be swept under the rug. I think this is something that we need to talk about, because the world is becoming more fucked up as we can see it, and the foreseeable future is that we are just these rats in a fucking we're just these experiment rats that these mad scientists have, and they're just, you know, doing whatever they want with us in this world. And then the elites are the ones that get away with everything and get to go and, you know, go in their private islands and hide out for mad long. I mean, I really believe that there is something bigger behind everything. This gets back to my other video on YouTube. You guys can check that out about the metaverse. This is all about control, and I think this whole COVID-19 pandemic has all been about controlling the people. And maybe there is a one world government going on behind the scenes, an Illuminati or something. Like, let's control people, give them more diseases, more diabetes, more diabetics in the world. That's something more and more fucked up that we need. And I tell you, I've been living with diabetes since I was 14. I'm 31 now. I swear to God, it's not an easy drug. It's not an easy disease to manage. It's very hard. And, occasionally, more than occasion, I eat shit I shouldn't be eating, because the American diet is so fucked up. The American people are all manipulated to this world that we live in, this society of materialistic, socialist government that we have. It's very fucked up how controlling it controls some people's minds, and politics should not be involved in anything anymore, but now more than ever they are, so there's nothing we can do about it. But diabetes is something that should not be messed with, and it's something that is a serious chronic disease that people struggle with on a daily basis to manage. And me having this disease, this topic kind of hits home for me, because I kind of can't stand how the government and how now we have this disease, this virus actually affecting people and making people become more susceptible to having diabetes. And I think it's hogwash. I think it's something that's and if it's not really doing that, maybe they're just telling people to go get vaccinated, because your kid might develop diabetes very soon or shortly or the year after, or because he did not get the vaccination, him catching the coronavirus has weakened his insulin cells, his insulin beta cells, or whatever the fuck. I'm not a doctor by any means, as I said before. This could be just news coming out of the CDC, because there's not many people getting their kids vaccinated. They have so many vaccinations available now, and it's like people aren't really listening to the news or the government to go get vaxxed. I don't think many people are getting vaxxed anymore. I mean, there's a lot of people that... I'm not a pro-vaxxer, I'm not an anti-vaxxer, but I'm saying the government wants everybody to be vaccinated. They spend millions and billions of dollars on this. They need people to get vaccinated, and they're trying to scare you to go get vaccinated by telling you that your kid could become a diabetic if he doesn't get vaccinated. And maybe this is, maybe that's some speculation that I have, but, diabetes is not a fun thing to have, so I do recommend taking all precautions. But yeah, so what are your thoughts on this topic? This is Unidentified Truth. I hope you guys enjoyed this episode and this topic for today.
Really ridiculous. It's crazy. There's more and more information being spilled out to the public about what this COVID-19 is all about, and what it does to the human body, and how it could be a manipulation of a lot of things that were done in that Wuhan lab or wherever fucking lab it came from. I just don't see how this disease, and now you're saying that it's linked to diabetes, and even though it might be linked to kids who are overweight and are less than active than most kids, it makes crazy sense that the government would do something, or any government would be doing this. Like the Chinese government could be doing this to have control over us in this future. Like the future is coming fast, and I think that governments are more than ever now, more than ever, preparing for a future, and they want it that way. They want us to be on this earth unhealthy and not being able to take care of ourselves. And it's a very, very, very terrible thing, and to know that there's possibly something behind it, that's even worse. And these doctors will say, oh, well, you get COVID-19, it affects your immune system, it affects your viral immune system, it affects the way we handle insulin, and your cells handle insulin because of you being so sick. Your body can't control what COVID-19 is doing to your blood cells, and it's messing with your insulin cells, and that's what's causing you to become a diabetic. But to me, that is such bullshit. You know what I'm saying? Like that is fucking crazy bullshit. That is like, damn, like, you know what? Like, so now we're probably killing people more by giving them after effects of COVID-19, by making sure that they have long-term effects from this disease. And one of those long-term effects could be diabetes, along with freaking heart problems, breathing problems, losing your sense of smell and shit like that. I mean, I lost my sense of smell and everything when I had COVID-19. I couldn't taste, couldn't smell, but it only lasted for a couple of days. But there's people that have this problem, like ear ringing. I don't know. It's just bullshit that's being displayed to our government, and it's kind of makes you feel like we are these little rats in this freaking, in this world where the rich are getting richer and the poor are getting poorer, and that's how they're kind of setting it up, and maybe that's what it's going on. But the CDC is even saying that diabetes is being linked to COVID-19. Why?
I guess we already knew that COVID-19 was like bringing out a lot of just bringing on a lot of health problems, and pretty much all health problems that you can imagine are just being exposed to COVID-19. Like, it's really wrecking people's immune systems. And I'm not a scientist, I'm not a doctor, but just reading this, it just seems like there's something inside this virus that is pretty much setting us up to really get really fucked up. If we ever find out that the coronavirus was leaked from a fucking Wuhan lab, people should be able to should be encouraged to get some money out of it or something, especially if you end up with diabetes, and especially with the CDC reporting that diabetes is linked to coronavirus. This leads you to want to know, like, what's really up with the coronavirus. Is this thing really attacking people's immune systems? Is it really giving people diabetes? Is it really starting to become, like, the CDC is reporting that this is happening, and especially they're reporting that children are getting, more and more children are being diagnosed with diabetes, especially after they were COVID-19. I mean, it's crazy. It's crazy. The crazy times we live in, crazy world.
And maybe if we are, getting diagnosed with diabetes, that maybe diabetic supply should not be this much. If they're going to give us a stimulus package, they should give it to people that get diagnosed with diabetes after contracting COVID. Why not? That's what my thing is. If you're going to say that we are freaking getting diabetes because of coronavirus, well, fucking, we should be getting fucking our diabetic supplies for free then.
This is Unidentified Truth, and this is Stephen Truth, and thank you for listening today, and always search for that truth. Thank you. Oh yeah.